طيب. بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على سيدنا Muhammad, Rasulullah sallallahu alaihi wasallam. First, I want to thank organizing committee for giving me this chance to present my presentation. My presentation about the scoring system for atopic dermatitis outcomes measure. As Dr. Ahmed mentioned, that it is it's very important to see our patient regarding quality of life. And Dr. Hajar, she's mentioned about the scoring system is the cornerstone for registry, especially for chronic diseases. Okay, I don't have any conflict of interest regarding this presentation. Okay. So I think before we proceed to the my presentation, we have to ask ourselves why we should measure a disease activity in the skin diseases, specifically by different assessment tool. Because it is very important to assess our treatment decision, and also for medical documentation and for disease classification, specifically regarding the severity of a skin disease, and also for clinical development and regulatory approval, and also reimbursement of new medication, and for looking treatment outcome assessment. This is my outline of presentation. There is 4 core outcome domain that are using in clinical study of atopic dermatitis and also in real life clinic. We are looking for clinical sign measure by the physician. We are looking for the patient report symptoms. We are looking for the quality of life of our patient and to make sure that the disease is controlled or not. Let us start with the clinical sign measured by the physician, which include EASI score, investigation, global assessment, and body surface area and SCORAD. Let us start with the body surface area. I think you are all familiar with how to measure the body surface area. We are used to use the rule of 9. 1% it is the palm, and the side. The surface area is different between adult and child and the infants. What about investigator global assessment? It is a physician global assessment that are used commonly in atopic dermatitis clinical trial from North America, but less so in other countries. But usually in our real practice, we are using something called physician global assessment. Our usually target investigation global assessment range from 0 to 1, which is mean that it is mild disease or there is no activity of the disease. And most of the clinical trials, they are using typical clinical trial enrollment of case of moderate and severe atopic dermatitis, which the scores ranging from the 3 to 4. The second one is eczema area and severity index score, which is called EASI score. EASI score, how to measure or how to use EASI score. Let us start with the first decided and selected the body area. We have 4 body area. We have a head and neck and trunk and upper extremity and also lower extremity. Second, we need to assess the extent of the eczema in that body surface area. And it's based on the percentage of the body surface area involvement. For example, there is a pointer here. The red one is a pointer. That's okay. For example, if the body area involved 1 to 9%, this means that the score is 1. If the body area, for example, 50 to 69%, this means that the score is 5. So we have to first decide the different 4 body score, and after the decision of the body region, we have also to assess the extent of the eczema. After that, we are looking for our sign. We have 4 signs. We have looking for erythema, for edema and papulation, and for excoriation and lignification. For each severity of each sign, we have 4. 0 is none, 1 is mild, 2 is moderate, and 3 is severe, as you can see in this picture. It's very important and take to the average of the severity across of the involved areas. Okay, it's very important that include only inflamed area. Okay, don't include the xerosis, which is dryness, or ichthyosis, or keratosis pilaris, or urticaria, or other skin sign. Just only the inflamed area of atopic dermatitis. Okay, this is the simple diagram how to calculate it. You know is the score. Let us, for example, if the body region, head and neck, let us say that for this patient, the erythema is 1, edema population is 1, excoriation is 1, lactification, let us say 1, and area score is 3. So we will multiply by 0, 1. 0, 1 multiply is different from 0, 1, 0, 3, 0, 2, 0, 4. This is based on the size of the body surface area in the body. So the score, the total score, 24.8. So 24.8 is under a category of severe EASI score. So this patient is severe atopic dermatitis. What about the SCORAT? The SCORAT, it is similar to the EASI regarding the sign, but it's added to other sign which is not mentioned in the EASI score, which is a scratch mark and also dryness. And also in the EASI, we are not looking for the subjective symptom. In SCORAT, we are looking for the itching and looking for also the sleep effectiveness. So what is how to calculate the SCORAT? Also based on the body surface area, we are using the rule of 9 also with the intensity, with the symptom. By the end, we are use this equation. A divided over 5 plus 7 multiplied by B divided by 2 plus C. So the total score will show us what is the severity of atopic dermatitis. If it's less than 25, we consider it is mild. From 25 to 50, we consider it is moderate. And if it is more than 50, we consider it as severe atopic dermatitis. Okay, second domain, which is the quality of life. Quality of life, we are usually in our in our clinic, we are use DLQI, which is simple questionnaire we usually distribute to our patient. Patient answer by themselves. And the other one is the hospital anxiety and depression scale. This is usually they are using in the clinical trial. And sometimes if you feel that this patient has, a mental problem. I think you are all familiar with the DLQI. It is a 10 questionnaire covering 6 domains. It's very important to know that the response from 0, which is not affected at all, 3 is very much affected to the patient. Overall score is ranging between 0 to 30. Lower score is means that higher quality of life, and the number of patients achieve no effect, which is our target, is DLQI 0 to 1, or reduction at least 5 point in DLQI, which is also this is our target. This is the question. It is the 10 questions covering the different aspects of the quality of our life, and the maximum score, as I mentioned, that 30. And how to interpret the score? We are looking usually our score less than 5, which is just only a small effect. There is also Arabic translation of the DLQI. You can get it from the internet. What about hospital anxiety and depression scale, which is called HAD? HAD, we ask the patient how they have been feeling in the past week in the term of 2 parts, in the term of depression and also in the term of anxiety. This has 14-item question, 7 items relate to anxiety and 7 items relate to depression. Each item is scored from 0 to 3. And domain score as follows. If it is 7 or lower, we consider it as normal. If it is 8 to 10, it's borderline. If it is 11 or higher, indicated clinical anxiety or clinical depression. This is the form of the HAD. The third domain, which is a patient report system, okay, the famous one is patient-oriented eczema measure, but usually we are not, use it in our real life, but we are using in the research purposes. NRS, which is numerical rating scale, and VAS, visual assessment scale, and also atopic dermatitis impact scale and symptom scale. This is formal scoring. This is the item what we have to ask in our patient for the last weeks. How much have been skin problem affect your life? So it is a covering symptom, which is the itchy, and also covering the sign, which is the bleeding, waving, crack, flaps of dry or rough, and how many days have you sleep also affect the step. So it's covering two symptoms, which is itching and the sleep. How to respond? The score 0, there is no day effect during the last week. 1 to 2 days, if affect among 7 days, the score 1, and if it is every day, the score 4. How to interpret? If 0 to 2, it is clear, 2 to 7, mild, 7 to 16, moderate, and if it is very severe, 24 to 28. This is numerical rating scale. I think we are all familiar about just only simple question. We ask the question that how's the average of the pruritus for last 24 hours, and the patient said, let us say 3. If the 3, we consider it as a mild based on the interpretation down. 4 to 6 is moderate. If it is more than, it is 10 or more, it will be worse. This is the worst itching. There is another scale we call worst pruritus numerical rating scale. How to ask this patient regarding this one? We have to ask, how was your worst itching in the past 24 hours? So we have average and we have also the worst one. What about atopic dermatitis symptom scale? Okay, we have two parts. Atopic dermatitis symptom scale. Okay, they are looking for the symptom. Skin pain, skin cracks, dry skin, and other symptoms. And also we have looking for the atopic dermatitis impact, like, sleeping disturbance, and also regarding the daily activity, and also regarding emotional states. Okay, the last one, it is the disease control. What we call it, we are using atopic dermatitis control tools. It is simple, self-administered. We give it to our patient. Consists from 6 questions covering symptoms, and also covering the daily activity, covering the emotional, and also covering the itching. Change in the control status is very important regarding 5 points. If it decrease 5 points, this means that the disease is controlled. If this increase 5 points, this means that the disease is worsening. So what's our target? Our target ACDT total score less than 7. This is a questionnaire. Okay, as I mentioned that, this is 7 is controlled atopic dermatitis. It is more than 7 considered uncontrolled atopic dermatitis. So in summary, actually, unfortunately, there is no single score can capture multi-dimensional burden of atopic dermatitis. As you can see that most of the assessment tools, they are covering just only measuring the clinical sign. Maybe scoritis, they are covering a clinical sign and pruritus. While the patient report assessment scale also, DLQI just only measuring quality of life, PUM measuring symptom and pruritus, while ADCT may be covering the symptom, pruritus, mental health, quality of life, and also disease control. By the end, you can find the assessment score web application in the internet. Maybe if you are using this one, our tools, you can use this tools to measuring, more easier than calculate by equation. Thank you.